Hi everyone, thank you for joining our virtual dental shadower session. We want to remind you that in order to get your hours, you will have to take a short quiz, and as long as you get a 3 out of 5, you will earn your hours. The quiz link will be located in our link tree, which is in our Instagram bio. All right, so let's get started. We're very fortunate to have Dr. Wiggins for today's session. I'm handing the mic over to you. Feel free to start whenever you want.
Thank you so much. Well, I am so happy to be with you guys today. And this is such a cool platform, especially during COVID-19 to have this, virtual dental shadowing. As mentioned before, my name is Dr. LaJoi Wiggins. I am a pediatric dentist and I practice in Charlotte, North Carolina. I love it here and I look forward to answering all your questions if you guys have any. If you guys have any questions during, please don't hesitate to let our hosts know, or you guys can reach out to me afterwards. So let's begin. So again, my name is Dr. LaJoi Wiggins, and my specialty is pediatric dentistry. I'll get into why I chose pediatrics a little bit later in our session. For undergrad, I went to UNC Charlotte. I graduated in 2011, and I was explaining to some young ladies earlier today that I graduated actually in the fall of 2011, which is quite interesting because I know there's going to be a lot of non-traditional people applying to dental school this cycle. And I hope that me talking about my story gives you all hope that you don't have to go the traditional way to become a dentist. There's so many ways to become a dentist or to specialize. It's totally what fits your plan and what you want to do in your life. After that, I went to dental school at East Carolina School of Dental Medicine in 2017. In between my break, I was fortunate to take a year off and apply for the DAT. I also did a summer program at UConn. I'll be more than glad and happy to share that information with you all. It was very helpful to me. And I also took time to travel. I got to go a lot of fun places with my friends, and I worked for Apple, which is awesome. And it was a great talking point during my interviews. A lot of people wanted to know more about working for Apple. What did I do? How did I do it? And they thought that was a cool thing to do in my gap year. So if you guys are a non-traditional student, be not afraid. People love an interesting story. So for postgraduate, immediately after school, I just wasn't feeling like I was ready to go into pediatric dentistry. I spent a lot of time being involved in dental school. I was the 2015 and 2016 District 4 trustee for ASDA. With all that traveling I did for ASDA, when it came time to apply, I just didn't know for sure if that's what I wanted to do. So I wanted to do something that made me more comfortable, and I decided to do a general practice residency program. For those of you who do not know what that is, that's basically a residency program just in general dentistry, all aspects of general dentistry, just to make you more stronger. In dental school, you have a certain amount of requirements that you have to fulfill. Unfortunately, not all requirements are going to be equal. There might be some students who get more experience with root canals, and there's going to be more students who get more experience with doing crowns and bridges and different things like that. It really just depends on your patient base. So if you don't get a lot of those patients, you don't get the experience. Doing an additional program, which I recommend that everybody does, in a residency, allows you to get all the experience that you need. So I was fortunate to go to Oklahoma University Medical Center GPR program. No, I have no family in the Midwest outside of Texas, but I wanted to go to this program because not only was it focused on kids and special needs children, I got to do a lot of OR cases with general practice dentistry, a lot of stainless steel crowns, a lot of things that were kid focused. However, I also got to spend about 4 months at the Oklahoma VA. So the VA center with all the veterans and doing a lot of dental work on them, which was excellent because I got a lot of experience in doing extractions. And if you could do an extraction on what we call VA bone, one of the toughest bones to remove a tooth out of, you could do an extraction on your regular patients. So I was so fortunate to get that experience, and I gained a lot of knowledge out in Oklahoma. Immediately in my program, I decided that, hey, general dentistry is not for me. So I immediately applied to residency, and I was fortunate to match at the Virginia Commonwealth University School of Dentistry Pediatric Dentistry Residency Program. It was there I got not only my certificate in pediatric dentistry, but I got my master's in science in dentistry, which is awesome. A master's is not necessarily needed for you to practice dentistry, but if you have any hopes of teaching or doing other aspects within dentistry, I strongly recommend that you get additional education, as it will improve your resume and give you the experience you need to actually educate future students. So I graduated there recently in 2020 in June. And then, like a crazy person, during COVID, I decided only to take a week off and start working. And I thought I knew what I was doing, but I probably should have took more time off. But in my head, especially with all the increasing deaths and all the different things that was going on, and my job really needed extra help, I decided to just go ahead and start working. And I'll show you my schedule a little bit later and how crazy, working in the pediatric dentistry practice can get, but it is very, very busy, which is a good thing for us because we have the patient base, but it's also one of the things that you have to keep in mind when balancing not only your personal life, but your work life and different things. You want to make sure that you're keeping your mental health in check. So we'll talk about that a little bit later too. At my VCU program, I'm currently submitting a research project to a lot of different journals. I did research on the repeat full mouth dental rehabilitation of patients under general anesthesia. We were focused on Medicaid patients and why they had to go back for multiple visits. I'll explain to you what a full mouth dental rehab is a little bit later in our case studies. And here's my employment. You guys can Google it. I work at All Kids Pediatric Dentistry. We have 2 locations. We have one in the very, very south side of Charlotte, which is closer to South Carolina. And we have one right close to Uptown, probably about 10 minutes. So we see a vast majority of a different population group at both of those. So we get a lot of different experience, which is awesome. And we're definitely meeting the needs of a lot of kids in Charlotte, because we're one of the few practices that do take Medicaid. So we're seeing a lot of patients from everywhere. So this is a very good place to work. I love seeing these kids. I love helping the kids, and it's a very good experience for me so far. Oh, in this picture, this is my niece. She's one of my patients, and I love her to death, so I have permission to show this photo. But this is one of the joys about coming back to Charlotte, is that a lot of my friends who I went to school with, I'm now their child's doctor, which is amazing. So it comes full circle. Okay, so I wanted to provide you guys some study tips and advice on staying motivated. This is a long road ahead of you if you guys are considering becoming a dentist. And trust me, I have interesting short stories to share with you all if you guys would like to hear. One of the stories that I have is that even when I was an undergrad and I was in my biology major, my biology advisor, I would show her all of my scores and we would go over my transcripts and different things like that. And she basically told me I didn't have what it takes to become a dentist. And I looked at her like she was crazy and just basically left the meeting. And that's the kind of persistence that you're going to have to this. You're going to have a lot of people telling you that you don't have what it takes. You're going to have a lot of people discouraging you throughout your journey. You're going to have a lot of people talking about the downsides of going to school for additional 8 years and different things like that. You guys just got to stay motivated and stay focused and just know that, you know what, begin with the end in mind. Begin with the fact that you know what you want to do, stick to that. Times are going to go low, times are going to be high, but at the end of the day, you got to stick to your ultimate dream, and that's becoming a dentist. So what's some tips for you guys? It's going to be a lot of sacrifices, okay? There's going to be a lot of things that you're going to miss. There's going to be some night outs with some friends, some parties. You might even miss some family events. I miss a lot of weddings, baby showers, you name it. You're going to have to set out a lot of things in order to make your goal and your dreams a reality, okay? You're going to have to make a schedule. You're going to have to stick to it, even if that means you're going to stay up additional hours. I can't tell you many times that my friends have found me asleep in my bed with my biology books, okay? I was that dedicated that I was going to sleep with my books. And you got to be that with it. You got to be that tough and just that, that persistence that, you know what, I don't feel like studying today, but you know what, I got to do it. Don't procrastinate. You want to make sure that you do everything within a timely manner. That's why making a schedule will help you stick to that. This will also help you alleviate stress and will also allow you to always be properly prepared. You want to learn your study habits, not what others do, but you want to learn what works for you and not to compare yourself to others. You might be a type of person that can study one day and get an A. That's cool. That works good for you. Or you might be the person that, you know what, you need to study 3 weeks to get that A. And that's okay too. Whatever works for you, works for you. And just because it takes you 3 weeks does not make you less smarter or less equipped than the person who needs to study for only 1 day. Just find out what works to you and stick to it. You also want to review your tests and your previous assignments. I can't tell you how important this is, not only for your own personal knowledge, but for your future recommendations. I have built a lot of great relationships with my faculty by going to office hours and reviewing all of my test scores and all of my assignments with them. In fact, when I randomly decided to apply for dental school, when I took that year off, I was like, I don't know what I want to do this year, but I went to my summer program, as I mentioned before, and I told them that I wasn't ready to apply. I had a little bit of imposter syndrome. I just didn't think I was good enough yet. And I was like, I need more shadowing hours. I need more of this. And they were like, you need to just apply. So I randomly applied with no money. I was just like, okay, let me just do it. And it came time for recommendations. And I got my recommendations within 1 week because I had such a strong relationship with all of my faculty members that they were so dedicated to helping me. In fact, I got a C in my first Orgo Chem, which I was like fighting for that C because organic chemistry, the first time I took it, and I only took it one time, but the first class, it was like a different language to me and I couldn't get with it. But in the second class, I figured out how I needed to study for it and I stuck with it and I ended up getting an overall score of a B. And my faculty member for that class wrote me one of the strongest recommendations. She basically let them know that although she got the C, she's one of the smartest kids I have ever met. And that did a lot for my application, to say the least. The weakest score on my application, I had the strongest recommendation to show for it. So you want to make sure you have those strong recommendations and a strong relationship. So when it comes time to utilize that resource, you have it. You want to identify accountability partner. I have several people to make sure that I'm where I'm supposed to be, doing what I'm supposed to do, and focus. These people are going to push you in the moments that you don't want to do anything at all. You want to make sure you take care of your mental health. Yes, achieving the dream is important. However, if you're not here to be with us, if you're not mentally here, you're not going to be mentally there to take care of your patients. You can't pour from an empty cup. So although I'm telling you to push yourself, know when you push yourself enough that you need to go for a walk, you need to work out, you need to go get a massage, whatever it is that you do that's your me time, make sure you're taking care of your mental health, because at the end of the day, you cannot take care of yourself or take care of patients if this is not right. Stay motivated. Like I mentioned before, in life, everything doesn't go as planned, and there's going to be many people telling you that you can't do it, but you have to remember why you started, and remember the P's. Proper planning and preparation prevents poor performance. Let me tell you something. Preparation always meets opportunity. And a lot of times I may not have been the smartest person in the room, but I was prepared. So I got the opportunity. That is one of the key things in life. A lot of the most successful people aren't the smartest, they are the most prepared. So if you're going to be doing this, applying for dental school, the best advice I can give you right now is get really prepared, become really organized. So when people ask you for stuff, you can give them that information in less than 24 hours. So choosing specialties, pediatric dentistry edition. So why did I want to do pediatric dentistry? I had to really examine what made me happy. When was I my best self? And I found out, and I still see it to this day, I am my best self when I am working with special needs children. Children in general, I love working with, but for some reason, when I'm with special needs children, my whole soul lights up. I am my most softest, gentlest self ever. And that just made me happy. And that's one of the reasons why I wanted to do a GPR, because I didn't necessarily wanted to give up working with special needs kids. But then when I realized that, hey, as a pediatric dentistry specialist, I can work with special needs people. I'm like, okay, cool. I got a 2-for-1 right there. And so that's one of the things that really pushed me into the specialty, is the fact that I love kids, but I really love special needs children. And I really love helping people who are very vulnerable. And so that was a big push for me. Another thing was, I looked at what was I naturally good at. I was naturally good at behavior management. That's the key thing in pediatric dentistry that you have to be good at. And a lot of general dentists just don't want to manage kids' behavior. But for some reason, I was naturally good at gaining cooperation with kids, especially kids who are very uncooperative. To this day, we have kids that fight and scream, but for some reason, I say about 7 out of 10, I can get cooperation, which is awesome. Also, other factors that played into it, I looked at what did others see. So when I was a third and fourth year in clinic, a lot of faculty or a lot of dental assistants would come up to me and go, you really should specialize in peds. And I'll ask them why. And they would just let me know that my interaction with kids was really pure and they really liked to see it. These were strengths that were very easily identified by other people. So the more that they spoke life into me and told me that, hey, yeah, you're really great in this area, it pushed me and gave me the confidence to reassure myself that, yeah, I'm headed in the right direction. What is something I had trouble with, and I mentioned this before, imposter syndrome, the feeling of being unworthy, the feeling of failure, the feeling of I have no business being here. I had to really put that in check because you are worthy, you are qualified. If you are in dental school, you are qualified. And I had to really put those thoughts into perspective and make sure that I wasn't going to let those hinder me from actually achieving my goals. Balancing my schoolwork and extracurricular activities. As I mentioned before, I was very involved in ASDA. That's called American Student Dental Association. It's an umbrella under the ADA, which is the American Dental Association. And I did a lot of work with them and I loved it. However, there'll be some times that I will get off the airplane at 9 o'clock at night and I'll go home and I'll have to go straight to the lab. And I wouldn't leave the lab till 2 o'clock in the morning because I had a denture assignment that I had to turn in the morning. So it took that level of dedication. Like if I was going to be involved in these extracurricular activities, I understood that, when I got home from my trips, I would have to be in the lab or I had to be up studying late for that test the next morning. So that was hard to balance, but I did it. And managing failures. You're not going to be perfect. There's going to be a lot of failures that's going to come your way. You're going to fail a couple tests. You're going to fail a lot of practicals. And what do? Do you just fall out and cry about it and get discouraged? Or do you say, hey, evidently I'm struggling in this area. Let me find some help. Let me look at some YouTube videos. Let me go to some office hours. So just being able to navigate and pivot in those moments where I had little roadblocks, that was very key for me in getting to where I'm at today. Is there another specialty that you would have considered? Not another specialty. I can't see myself doing anything else other than doing general dentistry, but only focusing on special needs children and adults. That's the only thing that I think that would bring me joy. But I can honestly say that I am completely satisfied with the decision that I had made. I feel like I belong here. There's no other specialty or no other avenue within dentistry that I think I belong in. So I'm very content with my decision. So here's some common dental instruments that I use on a daily basis. First here to the left, this is a 110 plier, also called a Howe plier. We use this with our stainless steel crowns, which is on to my far right here. And that's basically to make the crowns a little bit shorter mesodistally, basically left to right distance between the teeth. We use this especially with kids who have large cavities in their teeth. We end up seeing a lot of space loss. So we want to reduce the size of the crown so they actually can fit and get a good seal. Next, we have T-bands. We use these for cavities or in between the teeth. These are what we call the flossing cavities. So for those of you who are not flossing, floss. But we make these bands and we kind of round them with our finger and then we kind of bend them to the point that they make a nice little band like you could put over your ring finger. They're very inexpensive. And basically we just slide them on the tooth, we fill the tooth up and we take them off and we get a nice white filling. Stainless steel crowns. If you're pediatric dentistry, you must be very well at fitting and seating stainless steel crowns. You do them probably like 20 times a day. We have a crimper down here at the bottom. That's for making the stainless steel crowns really, really tight, especially if they're loose. One thing about stainless steel crowns, they're not like permanent crowns that you get at the general dentist office. Permanent crowns have chemical retention, basically a nice bond between the cement and the tooth. With stainless steel crowns, there is no bond. It's just mechanical retention, which is why we crimp it, we bend it so that basically you're unable to take it off with your fingernail. If you could take a crown off with your fingernail, it's too loose. And so you make it really, really tight around the edges. So when you see it, you get a nice pop, and then you know, hey, you got a good crown. Next, we use this board for our knee-to-knee exams. This is for our little kids who are just babies and we need to do a dental exam. We find more control when they're in our lap. A lot of times we'll have the mom put their legs in between, their legs and their body in between each other, and they'll have the mom will lay the child into your lap. Mom will hold the hands, and you're able to have full control over the child because at this time they're wiggling like this. So you can do a full exam of their mouth, let mom know all their findings, and then you let them up nice and slow. Okay. We use this board sometimes in our practice. I prefer to just use my lap because I feel like I have more stability, but some parents do prefer to use this board just because it's nice and firm. And lastly, we have our papoose board, which I call my burrito wrap. We use this a lot for really, really young kids. I don't necessarily like to wrap kids unless I have to. If it's an emergency situation, such as a large swelling of the face, you have an abscess on your tooth, or if you're a special needs child and we have to get a good dental exam, we're going to have to wrap you. And this is for your own safety. It's for the kids' own safety, just to make sure that their arms and their legs don't start flying. Just imagine if you're giving an injection and a child is moving like this. You can not only hurt the child, but you can hurt yourself. You can hurt your dental assistant. Having them wrapped securely like this allows you to have control over the head so that you're able to do a full exam, do the treatment you can in a safe manner. And then afterwards, you let the child up, the mother will console them, let them calm down, and then you let them leave the appointment. So this is my typical day. Sometimes it's more. Summertime is coming. So in a pediatric dentistry practice, during the summertime is going to be the most busiest time that you're going to experience. Why? Kids are out of school. So you're going to see a lot of dental exams, especially this July with COVID. We had about 2 months closed. So we had a bunch of patients that we had to reschedule. Average day, a slow day, I saw maybe 45 patients. Average day, I'm seeing about 72 patients. It can get pretty crazy. In this blue column, this is going to be my restorative column. So this is when I'm actually doing dental work. So I see about 9 patients a day. And then in the far right columns, those are my hygiene columns. And so that's when I'm seeing patients doing their dental exams, checking for cavities, doing emergency appointments. All those fall in those columns. So it's a pretty busy day. So I don't really have time in the middle of the day to really take a break. You get a nice hour break during lunch. We take our lunch break from 1 to 2 because this gives us more time to schedule patients in the morning, more of our younger kids. So most common questions that we get from parents, everybody wants to know, will they need braces? A lot of times, yes, there's a lot of space deficiencies that kids experience that we're able to identify. We work hand in hand with orthodontists to provide children care. They want to know how their oral hygiene is. A lot of times parents are letting kids brush their teeth on their own, when in fact, kids should not be brushing their teeth probably to the age of 9 or when they show personal responsibility. So a 3-year-old is not going to do a good job brushing their teeth. So a lot of times we'll see kids have a lot of cavities early, and mom will say, they brush their teeth all the time. Yeah, but kids don't really have good manual dexterity to brush their teeth really well. So they need your parental help. So probably around the age of 8 or 9, some 6-year-olds can do a really good job, but we need the parents really checking. There's even some teenagers who don't do a good job that really need their parents being more on them on a day-to-day basis. They always want to know if they have any cavities or if they had trauma in the past, that they fell and they bumped their tooth. They want to make sure that tooth is okay, or, is he in pain, different things like that. So we get a variety of questions, but the main question I see all the time is, do they have cavities? Do they need braces? Okay. What are the toughest parts about proposing treatment plans? 1, making the parent realize that their child does have cavities. 2, making the parent realize that the treatment is necessary. So a lot of times parents will walk in and just say, they're just baby teeth. Is this necessary? And we have to explain to them that baby teeth, are important. They are space holders for the permanent teeth. And when you lose them too early, kids often experience crowding. We also have to let them know the effects of untreated tooth decay. that it could lead to malnutrition, that it could also lead to infection, difficulty eating, difficulty with speech. So we have to explain those things so that parents will understand that they're not just baby teeth. We also have to explain to them that infection can also affect the eruption of the permanent tooth. So when we break down little things like that and we really provide the education, parents are more likely to actually sign on to the treatment plan. Another issue is making the parents realize that their little baby is not an angel. So every parent thinks their child's an angel and that they could really do the treatment in the chair. But a lot of these kids don't really have the coping mechanisms that they need. So we really have to convince parents that, I know you want us to do this in office. However, your 3-year-old doesn't have the ability to cooperate. Or, just having them sign on, especially to general anesthesia. A lot of parents are scared about putting their child to sleep. But what we often will do, we'll allow them to come in for one visit and let them see their child attempt to get treatment in the chair. Oftentimes the appointment will fail and we have to abort treatment. And then at that point, the parent will sign on to general anesthesia. So we're going to transition to dental cases. So I have a few cases that I am going to share with you from residency, and I believe I have one from private practice. In residency, I have a ton of different cases. The fortunate thing about it, when you're up in the middle of the night going to the ED, you forget to take pictures and document everything. A lot of our calls came around 12 to 2 o'clock in the morning. So the last thing I was thinking about a lot of times was taking a picture. But I did capture a lot of good cases. So I'm going to share with you a few that I have a lot of good information about. So the first team I have here is a 17-year-old. So peds, you can see kids up to whatever age you want. There's some pediatric dentists that see their kids up to when they get out of college, different things like that. We cut off ours at 16 just because we see so many kids in Charlotte. We're not able to see over a certain age, and then we don't really have the time to address a lot of permanent dentition. So we'll leave that to the general dentist. So around 16, we will dismiss kids. But in residency, we saw them up to the age of 18. So we had a 17-year-old. She presented to the P's ED at 6:42 p.m. She presented with her sister, which presents some concern because who do you need for consent? You need the parent. The mother was not present. The mother was in Georgia. The daughter was living in North Carolina temporarily. But when she came to the ED, she was like, my face is swollen. It's been like this for the last 2 days. It was the lower left side of her face. It was very swollen like this. Luckily, she denied any fevers, any difficulty breathing, any difficulty swallowing. We're really concerned about these things when there's facial swelling. Having an abscess is when you have a little pimple by the gum. But when you have facial swelling, that means that the abscess has resolved, but now it has gotten to the muscle and the other aspects of the face, different spaces of infection on the face. That's when things become a little bit more serious, when you want to address with a more sense of urgency. So the fact that she wasn't having any difficulty breathing was really good, because when you have compromised airway, that could lead to a lot of serious issues. And a lot of people do pass away from airway and from airway issues due to dental infections. Also, you don't want to see swellings in this area, because what do you have here? The eye. And what's up behind the eye? The brain. So dental infections up in here, untreated decay, especially in kids here, can quickly go to the brain. So you don't want to leave that alone. So only past history she had was asthma. She had her tonsils removed. She had no medications. And so I forgot to mention to you guys, some of these cases I'm going to present to you are going to be in the form of a SOAP note. So SOAP note is an outline of the dental exam. So the subjective is basically the information of the facts about the patient, okay? We're about to move to the objective, which is basically the findings of what I saw during my exam. So objective. So she was positive for trismus. Trismus means limited opening, difficulty opening. So basically she could only open about halfway of what she should be opening, okay? Edema means swelling. So she has swelling on the lower side of her face right here. She has swollen lip nose. And then she had negative soft tissue injuries, which let us know that this was a solely odontogenic infection. So basically a tooth infection versus anything from trauma, okay? And she had facial asymmetry. So when you're doing your dental exam, you're looking at the patient, you know it's swelling when you can look, you divide their face in half. And if it doesn't look the same on the other side, usually that swelling is what causes us concern. We do both a soft tissue exam and a hard tissue exam. So a soft tissue exam is basically, we look at the gums and the swelling around the gums, around the tooth. And then the hard tissue is when we actually examine the tooth. So when I looked at the tooth, it was what we call MODBO decay, which lists all the surfaces of the teeth. So the tooth was badly broken down to the nerve. And it was badly fractured due to the extent of the decay, which shows us that this has been untreated for such a long time. We're moving on to the assessment. So the SOA, the assessment, which is the diagnosis of what we found. And so what we found was that number 19, which was the tooth, had necrotic, basically a dead pulp. And as a result, the tooth being dead, it created a infection that has led to swelling. And so you're taking in all these things. You got to make a firm diagnosis before you actually do what? You go to the P part of the SOAP note, which is the plan. So we recommended that we place the Penrose Drain that night so that the infection can drain, and that then after the infection has drained, we take out the tooth in office. You never want to take out a tooth in the ED because you could lead to a lot of serious different things. So you want to take it out in office, especially a permanent tooth. So Penrose Drain. So this is a Penrose Drain. You can use anything. It's like basically a rubber tube. You can even use a glove and cut it in half. And what you do, you make an incision by the gums, and you slide this little tube into the tissues where the infection is, and you basically just leave it there. You put a suture to kind of tie it in there, and the infection will just drain over time. And so that's what we did. And as you can see that badly broken down tooth back there. And so we put that in there on basically a Friday night. And then basically we saw her that following Monday for treatment in the office. We also put her on an antibiotic as well to also address the swelling on her face. So that's some of the things that you're going to see. So when we see different types of trauma or different types of space infection, especially in the ED, they could be, blunt force trauma, like I knocked out my front tooth, or it could just be like I have a badly treated tooth decay and now I got this facial swelling. So this is one of my largest facial swelling cases that I saw in the ED, which I got to do the Penrose Drain. It was cool because I had an oral surgery resident with me, basically instructing me what to do. He just basically told me what to do and I did it, and I got his approval. So that made me feel so excited. So moving on to dental case number 2. So I mentioned before full mouth dental rehab. So we call that for short FMDR. So basically any kid that we have to take to the OR for multiple quads. So if you divide the mouth up into 4 boxes, we call that 4 quads. So anytime we have to take kids for multiple quads to the OR, we call that a full mouth case. And it's dental rehab because we're doing everything at one time. This is a wonderful service that we provide for patients. So this is my first case with my little kid right here. As you can see, he was a 5-year-old patient that presented due to, we call every kid who goes to the OR, our diagnosis is situational anxiety to dental treatment. He's a healthy child, no additional concerns, but he just had a lot of cavities. As you can see, these little black spots on the teeth. We often do something called SDF, silver diamine fluoride. We would treat cavities with this just to basically hold it off from progressing until we can get the child into the OR. In this case, it had done wonders for this kid because had we not had placed this, these 4 teeth in the front probably would need to be extracted. And so you're going to see these little black spots. You also see this tooth back here, this little black hole in the bottom picture. That's basically tooth number K, but it was badly broken down to the point that there was nothing to restore. We just had to basically extract that tooth down there. Okay. And so I wanted to show you guys that because untreated tooth decay can be really, really bad in kids. So had we not got that out in a timely manner, that could have probably led to a facial swelling. So here's on the left, we have some before pictures. You can see more of the SDF being treated, placed on the teeth. SDF is really common in pediatric dentistry. A lot of pediatric dentists use this, especially on uncooperative kids. This is a very good adjunct that we use. However, SDF, silver diamine fluoride, is not as successful in patients who have poor oral hygiene or they don't discontinue their poor dietary habits, like drinking juice all day and different things like that. It's really going to take the parent doing a lot of brushing and taking care of these teeth in between their dental exam and their dental appointment under general anesthesia. In this case, his mother, she really did a really good job because the cavities here did not progress. So on the left, you have some before pictures. And on the right, you have some after pictures. So what we did in the front, we did some crowns. These are called New Smile Aesthetic crowns. So they have a white surface in the front and they have a metal surface in the back. Okay, so there's different types of white fillings that you could do for the front teeth. You could do a composite strip crown, which is a large white filling, kind of like a veneer, right, for all the front teeth. Those are really good for patients who have minimal caries in between the teeth, or basically just not too advanced. They have really good hygiene. All this really good for those types of patients. They're not good for patients who have a really deep bite or really grind their teeth because they're going to fracture that white filling. This patient here, he had a really, really deep bite and he really grind his teeth. So we wanted to put something up there that was going to last him a long time. Also, he was missing a lot of tooth structure. So composite strip crowns wasn't going to be ideal for him. And we didn't want to put a silver crown on his front tooth in the front because there's a lot of social aspects that go into that. And we don't want to send kids to school with metal front teeth. So we went with this option here, which came out really, really nice. The canines, which are at the bottom, the two silver teeth. So we had to decide to put silver crowns on those teeth just because there wasn't a lot of tooth structure and the cavities was big. And it was either put the silver crowns on or extract the tooth. And when you come to realize with pediatric dentistry, as I mentioned before, we work with orthodontists. They really do not like to have the canines prematurely extracted because it affects the way the dental arch is shaped. So we want to preserve those teeth as much as possible. So even if it has a silver crown, it's best just to go ahead and put a silver crown up there versus just extracting the tooth. As you can see, we had to extract the teeth behind because the cavities were so big. A lot of times we're treating with what we call a pulpotomy, which is basically you take the top part of the tooth, of the nerve out the tooth, and then you put a little bit of medicine in it and you put a crown over it. If the tooth is not responding well to therapy, we end up having to extract the tooth. And so that's what we had to do in this case. And to control bleeding, we went ahead and put sutures down there because when you're extubating the patient, meaning that when you're taking the tube out, as you can see the nasal tube through his nose, you don't want the anesthesiologist really struggling with controlling blood, right? Because that could present a medical emergency within itself. So you want to make sure you make a good situation that when the anesthesiologist is taking over the case to wake the kid up, they can actually wake the kid up safely. So we put sutures in them on those sockets. The next case we have here is a frenectomy. So this is one of the patients I've seen here in Charlotte. Very sweet mom. She was just so frustrated when she came to our appointment because she had a 3-week go when she was saying that he wasn't latching well. She was trying to breastfeed and he just could not do it. And he would become very gassy because he was just sucking in a lot of air when he was just trying to grab something in the mom's nipple. The pediatrician was also concerned that the child wasn't gaining the necessary weight that he needed to because he couldn't even latch onto the nipple or even latch onto the bottle well. We also noted that with the frenum, it was very, very low. As you can see right here, it was also causing blanching in the tissues. That's not necessarily ideal. Sometimes we'll leave it alone if the child can eat, but he wasn't eating. So we also noted that in our findings as well. The kid was greater than 10 days, which is good. So when you're having a 3-week go and you're deciding whether or not you should do a frenectomy, which is basically getting rid of the lip tie, you want to also take in consideration how old the patient is because when they're babies, they haven't started producing vitamin K. And vitamin K is very important because vitamin K helps with blood clots. And so if the kid can't clot, that could lead to serious issues. So after 10 days, they have enough vitamin K production within their system, as well as the pediatricians are starting to give vitamin K shots at the time of birth. So bleeding was not an issue, but you also want to note that in your exam, especially in your documentation. Okay. So we were able to help this mom out. We didn't use a laser. We used something called electrosurge, which basically just did the same thing as a laser. And this is our final result. So what we did here We started at the tip of the gums where the tissues was blanched. Blanched means white. And we basically just made an incision going all the way up to the point that we could pull his lip up freely. It makes this ugly little diamond incision right here. And as you can see, you're like, oh, the baby might be in so much pain, he's bleeding. No big deal. What we do, we have the mother latch onto the nipple right afterwards. And that soothing effect of latching and sucking on a mom's breast actually brings a lot of pain relief to the child. And it's actually a beautiful experience to watch because you could tell the mom, she's immediately so excited because now her child can breastfeed it. Every mother wants to breastfeed successfully. So the mom's relieved because the child can eat. So it's a nice thing to watch. So we have mom do that for about 15 minutes just so that the patient can get out of pain. And then she just has to monitor the area for the next couple of days because it can't reattach. And that's a closer up view. As you can see, the blanched tissues, and that's the little diamond incision, and that's what you want to go for. Okay, so this concludes my presentation. I know I went over a lot of different information, but if you guys have any personal questions that you want to ask about my road to pediatric dentistry or staying encouraged or different programs to look out for to give you some more experience, I'm more than open to helping you all. I really want to see everyone succeed. And that is my goal in life because I have so many people helping me get to my point that it's my job to give back. So I'm open to any questions that you guys may have.
So that was great. And we do have a couple of questions. So for our first question, how has dentistry changed as a pediatric dentist during COVID?
Okay, so my biggest thing is that I love connecting with patients. And one of the biggest things, especially with kids, is that face-to-face interaction. I started my private practice wearing a mask. Nobody really knows what my face looks like unless they go to my website. And so I really hate that, you know. Luckily, the kids have adapted to wearing a mask pretty well, but it is pretty scary when you come in, you got your N95 on, you got another mask on, you got a face shield, you got a full gown. I feel like you lose a lot of that patient rapport and that patient building relationship by just having all this garment on. Before, you could just take your mask off after the exam and have a conversation, but we can't even be in the office without a mask. So I really do, that's the one part of it that I understand, but I hate that because I really want to build that bond with a lot of my patients and their parents.
So the next question is, you mentioned that you worked for Apple. Can you share what you did?
Yeah, so I work for Apple support. So when you would call in for customer care, I was the one on the phone and handling a lot of tech support, a lot of, I'm working more so with the Mac software support. So a lot of issues happening with the software, if my computer won't open, or the fan's still running, different things like that. And I helped manage not only the software issues, but if I couldn't manage the software issues, say if they need to go into a repair, I help settle repairs. Also, I help forward people to senior managers if they needed more additional help that was beyond our control. So it was really cool because I had a Mac at the time and there was a lot of different things I didn't really know how to do. But after working for Apple, it made me a lot more familiar with those things. So it was a really cool experience for sure.
Oh, that sounds great. You mentioned that you had a strong relationship with your faculty. How did you build that relationship?
Office hours, asking questions, like a genuine relationship, not like brown nosing, like, oh, I just want to, follow you around, but like, hey, I need some help in this assignment. Can you help me? I will sit out their office hours. I will come during lunch. I will find them. And then it just, the relationship became just so genuine to the point that I still talk to all my faculty from dental school. I still have a relationship with my faculty from UNC Charlotte, just based off of office hours. And the relationship just naturally built. It was to the point that I remember I signed up for biochem. I don't know why I did this, but everybody said the teacher was hard. He was just a mean guy. And it was only 8 people in the class, so that should have told me enough there. And then the first day, he was like, half of you guys won't make it. And I was like, well, I'm not going to be part of that half because I'm trying to apply to dental school and I don't want to F on my transcript. So I literally walked back over to the biology department and I walked over to my faculty member I took 2 classes with him, and I always went to his office hours. He knew me, and not only did he knew me, but he was willing to add me onto his class. He had no open seats in his class, but he added me onto his class, and he gave me a letter that I needed to go to the dean of students. So just by going to office hours, it provided me favor in difficult situations. So going to office hours, asking questions, I sat in the front of class. I always sat in the learning tee. My teachers knew me. Okay, I would go up to them after class to ask them to clarify information I heard that day. I sent emails. I just basically was letting them know like I'm serious about their class, and they respected that so much.
So our next question is, when people told you that you don't have what it takes for dentistry, how did you motivate yourself?
I had to believe in myself. I had to know that I could do it. 2, my parents. My parents was encouraging me. My friends were encouraging me. I surrounded myself with people who were positive and uplifting. And you just really got to dig down, and you got to tell yourself that, no matter what it takes, I'm going to do it. Like, I had so many friends in the first biology class. The first F that they got, they dropped. They just gave up on their dream because they saw one moment of difficulty. And I was just like, no, we are in this for the long haul. And guess what? Things got better. And I got an A in the class. Like, you just really have to find those moments of adversity and just decide that, you know what? I know it doesn't look right. I know it's hard, but I want to do this. So I'm going to make it happen. And you just really have to have that drive.
So when in dental school, do we get a chance to work specifically with kids, or is it more of a chance if a child is a patient of yours?
Okay, so it depends on your dental school. I know at my dental school, you would have blocks of time where you had to spend a certain amount of time in a certain clinic. So you may have a day on your schedule that you had to spend in the pediatric dentistry clinic. And so you will go like once a day or twice a day, and you'll have to spend that time just in that clinic seeing a patient. Now, I was interested in peds, and my faculty knew I was interested in peds, so I got more days added on my schedule to spend time in a pediatric dentistry clinic, if that makes sense. So it really just depends on your dental school. I know some some students say that because they have a pediatric dentistry residency program, they don't get to see as many kids as they would like. I feel like some students may have had that issue at VCU because we had a full functioning program, but it really just depends on your school.
And our next question is, what are some suggestions for someone who's preparing for the DAT?
Okay, so let me see what I use. I use Chad's videos. I don't know if he's still around, but Chad's videos were awesome for chemistry. What's that dental book? It's like the red and blue. It's like the red and blue book. I forgot what it is, but it's like a AP biology book or something like that. But it was like yellow. One was red, white, and blue, and the other one was yellow. I'll have to find it and kind of just post it, send it to you guys to send it out to everybody. But those were 2 great books to kind of cover. And I believe it was a software called Crack the Dat. I don't know if Crack the Dat is out, but I use that to practice taking the test. So my issue is I know a lot of information, but I have to get used to seeing that information presented to me in a question. So for order for me to do well on tests, I have to take multiple practice tests. And so that was something that I learned about myself with my study habits, is that it's not that I don't know the information. I just need to translate what that information means within a question. So whatever it is for you, you just have to figure that out. But for me, I just like to I think I've went out and I found a lot of software that had practice tests so I can get used to seeing that in the question, especially with the PAT. I think and one is Achiever. There was another software called, I think, Achiever, and they had a great PAT section, and that allowed me to get a really good score on PAT. So all the software that you can take advantage of, especially if you're the same way, you just need to see information over and over and over again, take advantage of that.
So the next question is, what is a Penrose Drain?
So like Penrose Drain, I mentioned it before, but it's like a little tube, okay? You use this with infections. So there's infections anywhere in the body. So somebody can have like appendix or something going on, and as an emergency way to drain the infection, you will make an incision in the tissue where the infection is. You'll stick that drain into that area, and then you'll just tie a knot to hold it there in place. And what it will allow it to do is just allow that pus to just drain over time. So it's a great thing to do for patients who have large facial swellings, and we don't want that swelling to get larger. You want to provide a spot, a little area where it can actually drain on its own, as well as provide an antibiotic to actually fight the infection.
So the next question is the Penrose drain connected to the lingual side of the gums?
The lingual sides of the, oh, in that one picture, no, because the swelling was out here. So it's in what we call the vestibule. Like, so basically that little area right here on the side of your gums, it's down there in that space. You don't want to push that to the lingual side of the gum. I don't think you can with the bone there.
So the next question is, how do you encourage or inform your younger patients and their parents about regular hygiene care?
So during the dental exam, so you don't want to tell a parent that they're not doing a good job, right? No parent really wants to hear that. You really have to figure out the way to soften the blow. So you just have to, what I do in my exams, I'll do my exam. I'll bring the mother over. I'll be like, Mom, do you see this? I'm like, okay, Mom, this is plaque. This is da-da-da-da. And I'm explaining all my findings. So this is the cavity. This is usually caused by this. Da-da-da. Does he brush his teeth on his own, or do you help? And so I like to bring the mom or dad a part of the exam with me so they can see the findings. And then afterwards, we kind of talk about how we can prevent this from happening again. Because no parent really wants to see their child have cavities, or you talk about their bad hygiene. So oftentimes, if you just ask mom at the start exam, do you brush your floss? I'm like, yeah, we brush your floss all the time. So I avoid asking that question because everybody's going to have a tendency to lie about that. So what I like to do is just bring the parent into the exam, show them what I see, show them, okay, these are areas that we're missing with our brushing. Do you mind helping? Da-da-da-da. And I kind of explain those things like that. I'm like, okay, in the next 6 months, we're going to be checking this again to see if you guys improve. So helping the mom and dad see it on their own without actually accusing them of doing a bad job allows me to see changes in their oral hygiene over time.
So the next question is, how do you make sure your patients aren't afraid of coming to you?
So let me see. Well, there's a lot of, especially during the dental exam, we start talking about cavities. A lot of kids will start crying because they don't want a cavity. They don't want to come back. So, I just start talking to them like, oh, we're going to have a great time. We're going to have a great visit. What we do, we're going to give you a bunch of stickers. After we give the injection, we give them a lollipop. So that helps distract them a bit. I'm like, when you come back, you're going to watch TV on the screen. So I'm talking about how it's going to be such a great day. So I'm hyping them up. And then while my dental assistant is talking to the patient, I'm also talking to mom. I'm letting mom know, please do not prep him for treatment. Don't tell him he's going to get a shot. Let us do our magic, right? Practice having a nasal hood over his nose. So you just put a cup over his face, different things, do that kind of prep work. So when he or she comes, they know what they're going to expect. So I just basically hype it up like it's going to be the best day ever, right? For kids who have trouble with dental cleanings, we often find that the first couple of times are going to be rough, but as long as we make it a fun exam and we really show them like, oh, you get a sticker and different things like that, over time, their behavior does improve. So, but as far as treatment, we just hype them up at the exam appointment to let them know it's going to be the best day ever. And then when they come in, we have a lot of energy. Are you ready to help? Are you ready to be a good helper? Okay, lay in a chair. And we just start talking real fast. We start talking about the things that they like, really relating with them. And that usually gets them excited and get them extracted from what actually is happening.
And for our last question, what's your favorite procedure to do?
Let me see. What I really like to do stainless steel crowns. I don't know, because they're super fast. And then The second the kid just really realized like, oh, he's getting treatment, we're done. So I really like to do stands crowns. I do like to do aesthetic dentistry. So I like to do white fillings on front teeth and different things like that because I like to see the patient's reaction to after the fact. I really like that before and after moment I can have with the patient. So those two things bring me a lot of joy.
Thank you, Dr. Wiggins, for taking the time to talk to us about your profession. It's truly appreciated, and I know I learned a lot from your presentation. To our viewers, remember that we will have a quiz today that will stay up for 24 hours. You can find the link in our Instagram bio. To Dr. Wiggins, I want to thank you again for taking the time to talk to us today. Everyone, have a great day.
Thank you.